Hi, in this video we will be talking about anatomical terminology by Marwan and Julia. Anatomical position is used to describe the locations and relationships of anatomical parts on your body. An anatomical position requires a person to be in a standing upright position, feet together, arms slightly out to the side, head, eyes, and toes pointing forward, and your palms are facing forward.
Relationship between anatomical parts. Posterior meaning behind or towards the back. Anterior meaning in front of or towards the front. For example, the chest is anterior to the back. The ear is posterior to the nose. Superior and inferior. Superior means above or closer to the top. Inferior means below or lower than. For example, the head is superior to the chest, or the knee is inferior to the hip. Lateral and medial. Lateral means further from the midline of the body. Medial means closer to the midline of the body. For example, the spine is medial to the arm. The ear is lateral to the nose. Distal and proximal. This refers only to the limbs. Distal means further from the attachment point of the limb to the body. Proximal means closer to the attachment point of the limb to the body. For example, the hip is proximal to the ankle, or the fingers are distal to the elbow. Superficial and deep. Superficial means near the surface of the skin. Deep means closer to the core of the body. For example, the liver is deep to the skin, or the skin is superficial to the heart.
Now we will move on to planes of motion. First is a sagittal or median plane. It is a vertical plane that cuts the body into right and left sides. Next is the transverse or horizontal plane. This plane cuts the body into superior and inferior parts. Lastly, we have the frontal or coronal plane, which cuts the body into anterior and posterior parts. Alright, now we're moving on to movements. First off, we will start with the sagittal plane.
Flexion. Flexion is the result in a decrease of the angle between the two segments that meet at that joint. For example, flexion of the neck, or flexion at the elbow. Extension. Extension is the result in an increase of the angle between the two segments that meet at a joint. For example, extension of the neck, or extension at the elbow. Hyperextension is when the movement occurs beyond the extended position. There are different examples of flexion and extension throughout the body, such as shoulder flexion and extension, dorsiflexion and plantar flexion, which happens in the feet, finger flexion and extension, wrist flexion and extension.
Next up, we will be talking about the movements in the frontal plane.
Abduction and adduction. Abduction occurs when a body part is moved away from the midline of the body. Adduction, on the other hand, occurs when a body part is moved towards the midline of the body. Inversion and eversion. Eversion is when you turn the sole of your foot outward at the ankle. Inversion is when you turn the sole of your foot inward at the ankle. Elevation and depression. Elevation is when you raise a body part to a superior position. For example, raising your shoulders. Depression is when you lower a body part to an inferior position. For example, lowering your shoulders. Lateral bending is the bending of the spine in the frontal plane to the right or the left. For example, bending side to side at the waist.
Now, we will go over the movements in the transverse plane.
Internal and external rotation. Rotation is the movement of a bone around its axis. Internal rotation means rotates towards the midline. External rotation means rotate away from the midline. Supination and pronation. Supination is rotating your hand so your palm faces up. Think of holding a bowl of soup. Pronation is rotating your hand so your palm faces down. Retraction and protraction. Retraction is when you bring your shoulders back just like the anatomical position. Protraction is when your shoulder is rounding.
Here are some special movements that wouldn't fall under the categories mentioned before. Circumduction is a combination of abduction, adduction, flexion, and extension. It is moving the shoulder or hip in a circular motion. Next is opposition and reposition. Opposition is bringing the thumb towards a finger. Reposition is returning the thumb back to anatomical position. We hope you enjoyed our presentation about anatomical terminology. Thank you for listening. Bye!
Created using Powtoon.